of the main health risks that our food safety program addresses is foodborne illness, commonly known as food poisoning. There's a number of factors that could contribute to a foodborne illness, such as time and temperature abuse, getting your foods from approved sources, sanitizing of equipment, utensils, cross-contamination, and just general food handling among factors that could contribute to a foodborne illness.
Our program is important because each year, roughly 1 out of every 6 people becomes sick with the foodborne illness. So that's a lot of people. In the United States alone, it's about 48 million. So, and of those, about 3,000 die. So it's relatively important. If I had to describe our program just in a nutshell, there's 17 inspecting sanitarians. We inspect roughly 3,500 facilities here in Summit County that have a food license. Those facilities are inspected sometimes multiple times per year, depending on the license that they've been issued, and sometimes there's some different licenses that are involved.
Some common misconceptions might be when we're going into these facilities for inspections, that we're there to just write people up and we want to shut them down, when that's not the case at all. We're there to educate, we're there to help them. We're on the same team as them. We don't want there to be any illnesses or outbreaks. We don't want anyone to get sick, and they don't want anyone to get sick.
I think probably one of the biggest misconceptions or myths about the topic, specifically to foodborne illness, is that most people associate the last place they ate with what made them sick. And that's generally not the case. I mean, it can be, but it's usually something that they ate the day before or even the day before that. 3 simple tips that folks can use to protect themselves or to improve their health. One is wash your hands. Wash your hands, wash your hands, wash your hands. 2 would be simply to not touch foods that are ready to eat or foods that are not going to be cooked before they go into somebody's mouth. Just don't touch them with your bare hands. Use a utensil, a spoon, a fork, whatever. And then the 3rd one, I guess, keep hot foods hot and cold foods cold. It's supposed to be hot, keep it hot. It's supposed to be cold, keep it cold. If the public would like more information about food safety, our website, which is www.scph.org, under program listings, you go to food safety, and then on there's educational materials galore. We also have a food safety basics class that we teach every other month. Generally, we have industry or restaurants come to that, but certainly anybody's welcome to come. You just fill out the registration form and send it in.